So, not taking much time, I just want to tell you what exactly we are dealing with that right now. Somehow, I happen to go into default into environmental medicine. What I will try to show what exactly we are meaning by that, and we are here trying to discuss why there is so much number of cases. We don't want Hyderabad to be diabetic capital. We all of us has to take some pledge for that, and we don't want cancer villages to come up. I will tell you what are cancer villages, and if the thing doesn't stop now, we are going to pay the price. And the thing which has changed over the last 50 years, it's only the chemicals. This is the clearly what we are talking about. 50 years back, we were not having this kind of chemicals. There is a 1500% increase in chemicals of that one, and our human body doesn't have that mechanism to take out this. We used to think that if somebody is sweating properly, somebody is not having constipated, and somebody is having a good liver and all that, he is able to take care of all the toxins. It's really difficult if we have all these things also. It is really difficult. I'll just show how things and all that. We have an amazing genetic kind of thing. We Indians, we have a dharovar of this one. Somehow we believe in Sanskriti. Our parents has given us Sanskriti. They have given us a kind of values. They have given us genes and all that. I am appalled. Some youngsters, they come to me and they say at the age of 30, they have, it's my dad's gift I have got diabetes. It's my dad's gift I have got heart problem. The thing is going that wrong. We are not happy. Grandfather getting a grandson for an angiography. This is happening now. We will try to understand why this kind of things are happening. Next time. See, the thing is, everybody is talking about, just now we were discussing with Dr. KLJ Rao, and he was telling the people who are not smokers, they are not getting cancer, and the people who are not, the people who are normally taking alcohol, they are not getting into liver problems. Okay, this is a kind of, it may be off record, but somehow I was told by my dad, don't drink or don't smoke. So I followed it till now. Now, if I give the same kind of values to my younger generation, they are just laughing at me. They say, the thing is, we need to give some more values so that we have to see that they don't get into this chronic medical diseases. What are the kind of cases what we are dealing right now is stage 4 cancers, and the thing what I have been observing is the smart, intelligent guys, 20 to 30 years old, they say, my dad has got a diabetic gangrene and all that. They were seeing all the audio and they are asking me what to do that so that I will not get into this one. We just try to, we have to get away from simple non smoking or something like that. We have to do something much better as such. So this is basically a science of metal toxicology. It is something like this is fueled by a thing who doesn't believe in the this respect environment. We see lot of offences. The other day, 2 days back, I was giving a talk in Bar Council, AP High Court. I was talking about in that level. I told them there are a lot of offences happening. There a lot of top distinguished lawyers are sitting in that there. They asked me what is it. I told him about that. There is a incessant kind of pollution, and people are thinking they can get away by this. They are just burning plastics. The place where I live, around that, daily, once or twice a day, people burn some papers or some plastics and all that. This is a major offences we are doing, and somehow we are going to pay a price. And I was really happy in Bar Council, they never had these plastic bottles. They had that steel jug with the glasses, that was steel glasses. I in fact told them I want to upload on my Facebook page, but the video and all that was not allowed there. Next. We want to get away, we should get away with these plastics and all that. We have to somehow come out of that. So what are the diseases we are talking about? Basically, I want to cover out major kind of things here. Number one is cancer, second one is diabetes, and the third, the heart disease. There are a lot of things. I just want to give you a brief overview what exactly we are trying to work it out. Last time I gave a talk in Multiple Sclerosis Society of India, MSSI, and all the patients were there. there is a group from 10 years old to 60-year-old people are there suffering. You know what was common among all of them? They were having dental amalgam. All of them, they had done the dental amalgam into the teeth, and subsequently they had got multiple sclerosis. We have enough evidences to show mercury causing multiple sclerosis. So I want to cover out something which is very important. Number is the cancer. I don't want this kind of things. As doctors, we should not fail to, we are just feeling like pins here. We keep hearing about so many things. We keep hearing, this is a very active person in our thing, and he had gone for a stent or a bypassing and all that. We really have to understand what we are trying. Cancer and environment correction. I would like to start with the case first. A 46 years old female, she's on our follow-up right now. She came to us post-chemo and post-surgery. And she was on combination chemo. After that, she went for aspirin also. Somehow it didn't work, and we started working on this lady. Next slide, please. These are some of the reports which showed consistent that was invasive ductal carcinoma. And to their surprise, after the things as such, she was almost, everything was fine, but she was having a skeletal metastasis. Her husband was a doctor, and he told me, not a medical doctor, but he's more of a researcher guy. He said, I just want to go for the detox and oxygen therapies. And we just took that cases. And over a period of time, we did something. I'll share my protocol, what I was trying to do with these people. And we were able to show in December 7, 2000, it was 10 as such. Can you show the previous report? That came as negative in 2010 October. We did follow-up scans. Last December also we did it again. Now she doesn't want to go for a bone scan. She's feeling better. She doesn't want to go for any radiation kind of thing. Next case. This 45-year-old patient, she came again with this particular problem. And when she came to us, she was having all the particular fluoride kind of this one. She was having neck nodes, which was post-dissection was done. After that, again it reappeared. And she came up with a PET scan, which showed throughout, there was skeletal metastasis present throughout. And we started our therapy over a 4 months track kind of thing. This is the PET scan. Next report. The latest PET scan was done on 18th of October, and we got PET scan was totally negative of cancer. Next slide. I just want to put across a kind of thing. It's highly thing as such. We have to put a break somewhere. We have to see that how this stop making cancer. We started a campaign on stop making cancer. All of you are having the things. There were some newspaper cuttings also we have pasted, and we feel that we have to do something so that we can work on this particular thing. All of us are invited. Dr. Shamsundar Prasad was one of them. Dr. H.M. Lal was one, and we started some stuff. Actually, we did a press conference and all that. We need to understand what causes cancer fundamentally. Normally, we are just tuned away whatever is being guided to us, and I would like to work on mostly heavy metal toxicity. I will show you the case studies. See, the modern oncology, whatever thing was done, it was done by Dr. Halstead has done the kind of thing. The focus he has missed was cancer physiology, which was aptly proven by Otto Warburg. And we have to understand metabolism of the cancer. Metabolism of the cancer, I mean to say that, I just want to take a few, this one for description. What is happening is, you have in the cell, which is the mitochondria, your mitochondria is getting impacted by some stuff, maybe your toxins or whatever things and all that. Your respiratory enzyme system gets blocked, and there you get into something called subcellular hypoxia. If already laboratory and everything has been proven, if you reduce the oxygen levels in the cell by more than 35%, you switch on from aerobic glycolysis to non-aerobic glycolysis. Your cell starts into a fermentative glycolysis. Fermentative glycolysis means it tries to take up a lot of carbohydrate, and at the end of the day, it gives only some ATPs with abundant lactic acid. Next. The thing is, this was the study which was done in Germany, which showed high levels of heavy metals in the breast tissue. I started talking with Rajshekhar and my friends as such, and we wanted to do something of the parallel thing here, but we are not able to do that. The thing is, next, what was the surprising thing was, there was a high accumulation of cadmium, nickel, iron, zinc, chromium, as well as aluminium in the breast tissue. The kind of whatever we used to do, we used to know whether it's a highly differentiated squamous or this one and all that, blah, blah. But we need to know what exactly is kind of thing. Next slide, please. So this basically, at the same kind of thing, there were some studies which were done, and it was found that high levels of nickel and iron was found in the prostatic cancer. So we have some kind of thing. There is a kind of studies which were thing, but only it was not totally on the this one. This is only the cause. It was not trying to show. Next slide. Apart from that, I just included these parabens, and we have seen now the baby shampoo, baby soaps, what we are using. Now the latest ad has come, which is telling parabens free. Parabens is a kind of, again, pesticide kind of thing, and it was known, all the DOs what you are using, all the antiperspirants you are using, it was loaded with parabens. They go into the sweat glands, they block into that, and they get into the tissue and can cause. I have more than 20 papers showing pesticides causing non-Hodgkin's lymphoma. I have not included all that things. I can always share with you. More than 20 papers. A day before yesterday, a farmer's wife came to us. She was having non-Hodgkin's lymphoma. We started with our therapies and all that. Non-Hodgkin's lymphoma, and the patient has got all groups where lymph nodes were involved. And the only thing which was done wrong was they were using pesticides, which we feel that's the kind of thing. Otherwise, we can't expect this kind of cancer villages. The people who are suffering, we had seen enough of cases. Next. So I just want to go very briefly on metal toxicity. What exactly? Why I am talking about metal toxicity much? Metal toxicity. There is something called heavy metals we are talking about, mercury, we are talking about something like cadmium and all that. What these people are doing is, they displace the normal minerals from the body. See, you have what in your normal, when we go to the biochemistry, there is a thing called magnesium, there is a thing called calcium, these are all the important things. We have got zinc and all that. Magnesium, for information, is required for more than 300 enzymatic reactions. And once we have a heavy metal there, you get into some heavy metal, this magnesium is displaced, and this nickel or cadmium is sitting over there. So all that metabolism comes to a screeching halt. And it can act as a respiratory poison, it can go into a kind of stuff and all that. So this is what exactly, cadmium, nickel and all that. We are sitting targets now. We are using non-stick cookery. I can name you so many things which are leading us directly there. Next. These are all there on my website. I just wanted to show what exactly, how these metals are causing some problem. Next slide. One more thing you can always go into is, when we are talking about this one, there is a thing called hexavalent chromium, and there is an environmentalist, Erin Brockovich, has done a great work in California, and there was an industrial effluents which were put into the lake that got polluted, and the whole locality along with that lake, they got into cancers. This was the phenomena, and she was able to file a kind of suit, and everything is on the web as such. You can always look into that particular. Next slide. Next slide. So that was I was trying to tell about hexavalent chromium, which is so dangerous kind of thing. We now are able to understand why non-smokers are getting lung cancer. It is probably because of the hexavalent chromium or nickel and all that. This was another study which was done post our Steve Jobs lost the job, he lost his life, the cancer. And now we have reasons to say pancreatic cancer is because of cadmium. In Boston, last time they were telling, India is a hub of cadmium. All rice eaters will have more cadmium, and the cadmium can go and cause a lot of problems. Explain. Dietary cadmium is, this is what exactly I was trying to tell about, because we have to look into what is the consumption of rice, what we are taking. The rice, unfortunately, is being grown in the paddy fields, and the whole paddy is cultivated by these fertilizers, which are called superphosphate fertilizers, which has got high levels of cadmium. So we need to be alert as such. Next slide. So this is what exactly we mean to say. When we have got a reason, there is a high levels of oxidative stress, we have got high levels of metals and all that, there is every reason for us to try to remove these heavy metals, and we can definitely do some definitive work. This is called, this is a studies which were done. Okay, it was done in vitro, but we are trying to compare with the in vivo studies. It's working out very well. There is a Swiss study also. Chelation is a big word, and I happened to learn this chelation only in post 2000, where I started working on this chelation, and it was I will tell you, it's amazing kind of stuff. We keep taking chelation ourselves. I am able to match up with my colleagues and all that, and everybody is like the energy levels and all that. What we try to work it out is it's just because of chelation. I keep doing chelation myself. I just don't use a face wash and all that. I try to keep myself clean internally. Next. So this was exactly what I was trying to tell across. This is one thing. Next, first. We are talking about the subcellular oxygen levels. When the subcellular oxygen levels decreases, we are talking about in the mitochondria basically. Mitochondria is 0.3% of the inhaled oxygen. Even if there is a compromise over there, you are going certainly getting the problem. This was the kind of work which was done by this one. There was a laboratory experiment was done, and the oxygen saturations was reduced. The moment it is reduced, the cell started becoming cancerous. Next slide. This was the guy who was Dr. Otto Warburg, and this is the guy. What he has shown basically is metabolism of cancers. Metabolism of cancers. Next. He won the Nobel Prize for that. He won next term. This metabolism of tumors as such. Now we are able to understand why some cancers which are hypoxic, they are resistant to radiotherapy as well as chemotherapy. The cancers which are something like seminoma, which are not that hypoxic, they are amenable very fast to chemotherapies because of the oxygen concentration. There is a benign tumor, there is a malignant tumor. Benign tumor has got a proper process. The oxidation levels are better. Maybe that is one of the things. And it is always this kind of connection was tried to work. A lot of people started working on that. And somewhere he proposed this particular thing. This subcellular hypoxia is the main cause of this one. And now we have got means. We started working with hyperbaric oxygen. We started working with oxygen, ozone therapies, and we were able to improve that hypoxia. The moment the hypoxia goes off, your cells can become normal. Next slide. These are the kind of studies. Next slide. In 99, 93 also, we are ready for this particular thing. We somehow feel that even in well centers, hyperbaric oxygen is one of the standard modalities for head and neck cancers. We somehow feel that it is not only for the head and neck, we can always use it for other things also. Next slide. Tumor oxygenation, we already told. Next slide. What was our protocol? Our protocol was slightly not very different as such. We started with the dental thing as such. All 97% of breast cancer patients, there was a study which was done, showed everybody had a dental amalgam. There was a study which showed patients undergoing root canal treatment, RCTs, they are more prone for cancer. We need to understand why this phenomenon is going. Maybe this is the mercury which is putting across there. There's so many metals and all that. We have to be very careful about that. We do a lot of supplements. We try to follow this particular stuff with vitamin C protocols. We try to do ozone, hyperbaric oxygen kind of stuff. And we do definitely deep breathing. Everything has to come into picture. Unless we balance your parasympathetic and sympathetic activity just by balancing, we have to look into things called yoga and meditation. Otherwise, we are not going to be a lambi race ka ghoda. We want to be lambi race ka ghoda. We don't want to end up very short. We have to take up all these measures so that we can definitely do a meaningful and quality life. This is what exactly I was trying to tell about cancer and hyperbaric oxygen. We started some time back. It's almost a year now, but the kind of reports what we are getting is amazing. I just wanted you can go to my site as such, but this is a classified information. This is upregulating so many genes in the body. There are 5,769 processes and there are 8,000 genes. See, we are talking about epigenetics now. We cannot take up. It is there in the genes. I don't know. My father has given me genes, and I'm definitely going to get it. I definitely postpone. If our grandfather got at 70 diabetes, and father got at 50, why you are going to get at 30? We can always get at 70. For that reason, there are something environmental factors which are making expression of gene very early. This expression of gene has to be, we can always delay that by doing this upregulation and downregulation and all that. Next slide. I don't want to go into the details of this one. Already we are late. We'll just, what is hyperbaric oxygen? With high pressure, we are giving oxygen. With that, it's a Coca-Cola principle. Your body, your RBCs are carrying the oxygen. With the hyperbaric oxygen, not only your RBCs, your plasma, your synovial fluid, your CSF, your lymphatics, everything is full of oxygen. And we have seen amazing results, not just with the cancer, we have seen with paralysis patients. We have seen people with grade 0 paralysis getting into grade 3 within a span of 3 weeks. Next. I think HBOT, I'll show you some more interesting stuff and all that next. This is what exactly in the brain I happened to do for one of the patients as such, and this was a kind of thing. There is a thing called your brain. When we look at the CT scan, we look at the kind of infarct. We see there is a black kind of thing which is infarct. With MRI, there is a kind of bright intense signals. And what we fail to look at that, there is a thing called around this one. There is a umbra and penumbra phenomena. You have got some cells which are in the mode of, they just go into dormancy. When you don't have oxygen, the cells go into kind of dormancy. People who are seeing Krish 3 might know about that. There is a kind of thing. You go into dormancy. So with HBOT, we reactivate this particular stuff. It's amazing. I have never seen this kind of results before. I used to just read it, things and all that. And I tell you something about chelation therapy. Chelation. And this is called TACT study. And there was a lot of controversy when I started chelation 10 years back. Last year, November 4, 2012, there was a TACT study report which has come, and it has surprised all of us. Now, when I am doing a chelation therapy, I had to take a College of Medicine, alternate medicine degree to continue with that. Now, any MBBS graduate can do that with this toxicity kind of thing, clinical mental toxicity. There is no more this one. TACT study has given us a full hands this one, and chelation therapy has a role in the cardiac things and all that. This is exactly we never understood. The angiography was normal for some patients, and still patient was having into. We used to call it as syndrome X or something. It's basically the microvascular changes. All my patients, which I'm doing for chelation and there is a thing called ECP. All of them are 90% of them are diabetics. Diabetics, they have a predisposition for this microangiopathy. The thing is, even if your big vessels are normal, and but there's a problem there. So this study showed, next slide. This study showed, next slide. there was a, I think next slide, I just want to show that. Diabetic patients, there was a high impetus which was put across in diabetic patients. This was a multi-million-dollar study which was done in US, and this showed there is a palpable difference in all the diabetic patients. And almost whatever cases what we have done here, most of them were diabetic and they started responding like anything. We used to have patients with peripheral neuropathy. He was on so many drugs and all that. The moment we started giving chelation therapy, the peripheral neuropathy is gone. It was a sensory neuropathy which was subsequent to the arsenic poisoning. I'll show you how arsenic can contribute to diabetes also. Next slide. These are our few cases. This patient came with a gangrene of last two fingers. Next slide. And MR angiography showed, and he was posted for below knee amputation. Then we went for this therapies with after all the documentation and all that. Next slide. And needless to say, all the angiography report, there was a diffuse plaque and there was a huge calcification, abdominal aorta and up to femorals as well as on both the legs. And we started doing some therapy, which was chelation therapy and ozone therapy. Next. Or during the therapy there was a response like that, and this was the result. Patient was having less pain, he had gangrene, now he was totally that gangrene was gone. I did a Doppler study on my own clinic because I was juggling between radiology, still I juggle between radiology and this one. I do my aspirations, all things and all that. I did my Doppler. To my surprise, the plaques which were there into the abdominal aorta and the femoral artery were the same. Only difference what was got was the peak systolic velocity in the popliteal artery, which got more than 6. There was an increase in, it went up to 15, something like that. Before it was very less. So what I mean to say that, what result I got, there was a palpable difference. Patient said, you are a god. The thing is, and I was scared to send it again to angiography, because the moment angiography is done, he says, what you have done, nothing was done, the gangrene is gone. So the thing, what I'm trying to put across is, it is a microvascular changes. We did do something in the microvascular changes, and that was the result. This was another case of a engineering graduate. She came with, this was a recent case, almost 1 year back as such, and 3 fingers were almost gangrene were there. Next slide. I just wanted to, Ramu, can you make it fast? Okay, this was fast. Okay, she had something like Takayusu's disease. There was absent pulses, and we did again the same protocol. We tried working out of this case was a aorta arthritis, and she was told that nothing, things and all that. We did chelation for her. Now she's got her job now. Next slide. This is the kind of result we have. She doesn't have any kind of thing there. She doesn't go into Raynaud's phenomena. Still, we are following up. It's almost post 1 year. This is one of the diabetic patient who had trophic ulcers. You see already some of the fingers were amputated. Next slide. Next slide. And this much we can do. After this, patient went for some Ayurveda or something like that. But there was this was a doctor's father. There was diabetic foot again. Next. He also went into, there was a good kind of response about that. And this is the, Ramu, make it fast, all the videos. And can you just play that? Double click. This is what exactly I started doing after I worked on
because the retrograde aortic blood flow produced arrives at the heart just when the heart relaxes. At the precise moment of the inception of diastole, there is an increase in coronary perfusion pressure and flow. Second, because pressure on the lower body vascular bed is released just before contraction, there is an immediate drop in peripheral vascular resistance, resulting in decreased
What I was trying to put across is, this was a case of this is called non-cardiac, it's called non-surgical bypass. We have been doing since some time now. This was first started in Escorts Hospital, and there were a lot of people who started working on that. I somehow last time I got a case which was, I still have that requisition with me. Ramakant Panda has referred a case. A person who goes back after a post bypass, he went to him again for a bypass. He said, "No, you go for this therapy." The funda is very simple. It's a clearly it is called non-surgical bypass. What we are trying to work it out is we are trying to treat the endothelial dysfunction here first. This particular thing, they suppose we have got a block in the LAD. Let's say this is the point where is the block as such. You have got a distal ischemia and all that. So by doing a non-surgical bypass, which is called external counterpulsation, it's a outpatient therapy. We just increase the pressure into the aorta as well as into the coronaries, whereby only during the diastolic phase, the diastolic filling increases, and once there is an increasing diastolic flow, there are some VEGF, there are some factors which get released, which causes collateral access. We used to tell our patients, go walk. We used to tell patients to go yoga. By that, what we are achieving, normal diastolic pressures in the coronaries are somewhere about 4 to 6 millimeters of mercury. By doing yoga, by doing walking, we increase up to 6 or 8 or maximum something like 10. Maybe Ramdev Baba can go up to 15. By doing this non-invasive therapy, we are increasing the pressures in the coronaries to up to 80, 90 or something like that. And with that, the endothelial dysfunction goes off and you start getting the collaterals. Bravo, next. Next. Go out, go out. Out. These are all, there are some things as such. We started, we had this particular thing. Just press it up. This is was a perfusion scan before and it was after perfusion scan. This was an interesting kind of thing. Before counterpulsation, you see the vascularity which is very sparse in the coronaries, and after counterpulsation you have got all neovascularization. Make it fast. This patient came to me and he had again this is the latest case what we are trying to work it out. He had this guy after almost he was into ventricular ectopics and so many things. He had an ejection fraction which was very low. Mostly whatever we try to do in cardiac cases is a combination doing chelation as well as ECP, and sometimes we try to work on oxygen therapy or hyperbaric oxygen. I'd like to deal very few lines about this particular thing. Epidemic in Hyderabad. मिठे हो गए पूरे लोग. क्या बजाज साहब? Everybody is sweet. हाँ? You accept that? Yeah. पंजाब में साला रोज खा रहे ना यार. They take Gurbachan ji. You tell me how can you digest jalebi in the morning and you don't have diabetes? Here, without anything, we are into diabetes. So we need to look at some other causes of diabetes. We go back. We are talking about. I'll show you the thing called alloxone. Alloxone is a chemical which is added to rice to make the rice more white. Sona Masuri rice, fresh, white dikhna. The thing is that alloxone is killing the beta cells of pancreas. There is the other thing called everywhere. The other day I went to Gilo shutdowns. You see that place in somewhere, that's some place actually, and more than 1,000 patients are already gone for renal transplant, and everybody is kind of thing. The thing is, by 25 you get the kidneys, both the kidneys get shrunk. It is because of this cadmium, because of the mercury things and all that. Cadmium will causes diabetes. So when you are talking about diabetes, we need to understand insulin. Insulin has got a long arm and it's a short arm. These two are connected by a disulfide bridges. Whatever toxicity, cadmium, mercury and all that, they like to attack that disulfide bridge. It's a very weak link as such. Not Tarun Tejpal, I'm talking about this cadmium and these guys. They just hit this particular thing and this is gone. The thing is, this is one thing. Next slide. Even the insulin resistance. When you are talking about insulin resistance, there's a thing called tyrosine kinase, the peripheral receptors, which is again a sulfur kind of maintaining. This may be one of the things. And once mercury, this is being peer reviewed, this paper was presented, it was shown conclusively that mercury causes pancreatic cell apoptosis. Next slide. This was the study which was done in Michigan, and they have done 8 to 10 micrograms in water inorganic arsenic, they were able to correlate with diabetes and other things. Sir, we did a study here. We tried to took from NIN also we tried to work out, and to a surprise, more than 30 micrograms is the standard kind of stuff. I'm not talking about the reverse or I'm talking about the normal water which is there. So we have to take this again with a pinch of salt. Next slide. Diabetes environment link. There are a lot of studies which were done. They were shown this particular thing. Next slide. Next. This is called dioxins. Dioxins and all that. Probably I read dioxins when I was trying to get into something called endometriosis. Endometriosis causes where one of the causes were dioxins, and we now feel that dioxins can be from your vaginal tampon. Dioxins can go there. So again, this dioxin. This was a Vietnam veteran study which showed the handlers, the kind of military people who were handling this particular toxic, this one, orange, all of them later after some time they get into this one. So this is what exactly I want to open the debate. We will try to talk about this, and somehow I feel that we are all into a big epidemic, and there is arsenic everywhere. I have not gone into details how arsenic is getting and all that. I can give you a simple example of arsenic, how we are getting. We are going to eat chicken today, which is broiler chicken. This chicken, to make it the more kind of muscle and all that, arsenic is added into the feed. So roxarsone it's called, which is causing the thing. And somewhere we get depressed looking at the stats basically, because everywhere this is a toxicity. Somewhere only thing there are a lot of studies. Next slide. I think I'm concluding. I just wanted to just give you this kind of overview. What is exactly this particular thing, and chronic medical diseases. It's a high time we have to start looking into the causes. And it's over. Yeah, it's over. It's a kind of we have to look into the causes, and once we feel that, we can do some. It's basically a public health measure. We need all of us to join this particular thing. And if any questions are there, I'll be most happy. You can always.